Okay, welcome everyone. And thank you for joining us today. My name is Nathan, and I'm here with Wesley. And today we're the spokespeople for Liberty and I, a group dedicated to defending rights and civil liberties of people in Northern Ireland. We're not anti-vaccine, but we're strongly anti-coercion. And today's discussion will be focus on the concerning implications of the new public health bill currently under consultation. We're thrilled to have some special guests with us today in our webinar and help break down the legal and the political and the human rights issues surrounding this bill, or proposed bill, I should say. Joining us from Advocacy Rights Network, ARN, is Darren, who will guide us through some of the issues and legal slash ethical issues that have been and the legal landscape and what the proposals could mean for individual freedoms. Later, we'll also hear from Melissa, and she's another key voice in ARN. And we're also honoured to have Paul Frew, MLA. He's a long-standing defender of liberty and human rights, and there's been no UK politician who has championed so publicly and consistently these rights. So Paul will offer his insights on the potential political fallout and what this bill could mean for the future of Northern Ireland's civil society. Together, we're going to explore some of the most concerning elements of the bill, including its vague definitions, broad powers of enforcement, and creation of surveillance within the state. Most importantly, we'll highlight some of the violations of personal autonomy and human rights that the bill poses, and while addressing the mental health impacts of such oppressive legislation. So thank you again for being here, and we encourage everyone to engage, comment, share this post and their perspectives as we dive into this critical discussion about the future of our civil liberties in Northern Ireland. So we're going to get started, and we're going to begin firstly with Paul. So we're going to dive into some of the details of the proposed public health bill, and there's no better person to start with than Paul Frew, MLA, who have said has been a staunch advocate for individual rights and liberties throughout his career. One of the few politicians, I might add, that actually reads history and philosophy, which is why he might be a wee bit further than most. Paul, you've seen the political landscape shift over the years, but this bill seems to be particularly troubling in terms of power it hands over the authorities and potential to infringe on personal freedom. So from your perspective, how do you see this playing out politically, and what kind of impact do you think this is going to have on the rights of individuals in Northern Ireland? And also, we'd love you to give your insight on the political consequences and what steps can be taken to safeguard our freedoms in light of these sweeping proposals. So it's over to you, Paul.
Thank you very much, Nathan, and thank you very much for the invite here tonight to discuss this with you. It is something that's close to my heart and always has been. As a libertarian politician, I am very aware of the power of government and making sure and ensuring that there's accountability there, and there's measures in place, barriers in place to always restrict that power and allow people the protection that democracy is designed to give them. But first of all, before going into the detail of the bill, I do think we need to contextualize this. I suppose the way I look at this, and what I have been warning for the last 4 years, is that the powers that the Department of Health took for themselves in a temporary fashion, the draconian powers of lockdown, of the vaccine certification scheme, all of those measures were enabled by temporary powers. And I had always suggested that the Department of Health would always try to make those powers permanent. And they had this continuum of always extending those temporary powers every 6 months. And I do believe that was so that they could run themselves in to a new piece of legislation that would make all of that permanent without having actually to break their powers. Now, that came to an end in February, where the majority of the Assembly voted the draconian powers down. The Minister at the time, Robin Swan, was quite confident of getting a further 6 months extension. But for whatever reason, the SDLP decided not to back it. When the SDLP decided not to back it, then Sinn Féin refused to support it, and the Alliance refused to support it also. So the only people then who supported the extension for a further 6 months was the UUP, the Minister's own party. So the Assembly did its job at last, eventually, and took away the damaging totalitarian and draconian powers that one person had. And remember what those powers granted him. He could dream up a new power, a new measure. He could ring up his legal team, his bill office in the morning, get them to draft something in the afternoon, and have it empowered in the evening, and have it enforced before we all went to bed by the PSNI. And then, and only then, 2 weeks later, would he bring it to the Assembly for a vote. And in some cases, the measures had already been eclipsed by further measures. So it really basically made a nonsense of the democratic process in the Assembly chamber. And the Assembly became a zombie parliament during that time. Those powers ended in February. And now what we have is a public health bill, which basically brings those draconian powers back in on a permanency and a permanent footing, but also enhances a lot of those powers. So we had the COVID vaccine certification scheme, which coerced people to take a vaccine. Now we have in the new bill the powers of mandatory vaccine. That's only one aspect to this. There's also the powers that it gives PHA and other organisations that they deem fit. And those include powers of court orders. They also include powers of entry. And so these are all really, really important issues. I could go into more detail about the measures in the consultation. What is fair to say is this, that every government in every country, in every state, probably should have public health legislation. The problem I have is the actual detail and the provisions that this new proposed public health bill will bring into force. Now, it's also important to say that if it's only the consultation stage, so there is no bill. I, as an MLA or any other MLA, have not had our hands on a blue bill, basically a bill that will go through Parliament or the Assembly. So all we have is the proposed measures that the Department of Health wants to put into the new public health bill. So that's what everybody should be responding to. These are measures that have been concocted up in the Department of Health, nowhere else. And the consultation will last. It's been extended for 2 weeks, and that's because basically of the uproar of the population, and rightly so. It's been extended for 2 weeks. And then what usually happens with every consultation, and there are many consultations published, the Department of Health takes all of those responses in, they'll assess them, they'll do a report on them, and then they will go and report to the Health Committee, the scrutinising body, who scrutinises the legislation and the policy around the Department of Health. They'll make comment on it, and then eventually, and this could be months away, could be this year or next year, the Department of Health will publish a new public health bill. And it's only then that we will be able to read the clauses of the bill and the provisions which are laid out within it. And then you're into what is the legislative process. And there are various stages. The first reading is basically just the title of the bill. The second reading is where MLAs get to vote on the principles of the bill. And then you go into a committee stage, if that passes, where the committee, the health committee in this case, will take months to scrutinise every clause and every line of the bill. And then they will do a report, a committee report, whether they like the bill, what's good about the bill, what clauses they support, what clauses they don't support. And then it goes to a consideration stage on the floor of the Assembly, where MLAs can put down amendments. And those amendments could be adding things to the bill or removing clauses from the bill. And that's all voted on. We vote for every single clause in that bill. And then it goes to a further consideration stage where you can make other further minor amendments. And then it goes to the final reading. And at that point, you then vote on the bill as it's been amended. So a tactic of a political rep will be this. First of all, do I like the bill? Do I not like the bill? Is there good things in the bill? Is there bad things in the bill? And you then come to a conclusion as a party, and these are party issues. Should we vote for the bill? Should we vote the bill down? If you vote the bill down and it loses its second reading, the bill's dead. If the bill succeeds in getting through second stage, then it goes to committee, and then from then on, it's about how do you amend this bill. And of course, with all of the issues, with all the provisions that's proposed by the Department of Health in this new public health bill, then at that point, I would be looking to make amendments to remove clauses and to prevent the Department of Health having that draconian power on a permanent footing or amending it. And so there's tactics at that point around how you neuter the power of the bill. And so that's basically the political process. What has probably alarmed me over the last number of days is that the focus has shifted from the Department of Health to all MLAs. All MLAs weren't talking about this. And that's true to say, because there are many consultations pushed out by many departments. You could get 5 in a week. And it's only the people, I suppose, who are aware and alert to these things, like me, who have been warning about this for the last 4 years, that will look into this. And I've actually worked on the consultation and the detail within it. Other MLAs won't be interested in public health or leave it to someone else within their party, all of that. But I think the groundswell of opinion that's come forward over the last couple of weeks, and certainly since I've been warning about this public health bill since July, it has really shook some of the political parties and some of the political reps, which is a really good thing. And so people are making attention to this, and they are looking at what their party position should be. And people have been filtering through what other MLAs from other parties have been responding to them. And I must say, I'm heartened by some of the responses that some of the other MLAs from the rival parties have been sending out. So it gives me hope that something like this will not get through unscathed, and that there'll be good political debates around all of this stuff. But what alarms me is that there's been this focus has shifted from the pressure on the Minister of Health and the Department of Health, which is this, the provisions have come from that department. And I've even seen criticism of the Health Committee. The Health Committee has had no part to play in this consultation. This consultation is from the Department of Health. But it will be those MLAs on the Committee for Health who will scrutinise each clause of this bill, each line of this bill. So those are probably some of the most important MLAs at the minute with regards to the public health bill. And it would be a really good thing if the population could make their views known to those people, to the people on the Health Committee, but be aware that it's those people that we're trying to convince that this bill is a really bad step. Bad step for many reasons. A bad step for public health. We have looked and seen and experienced what we have lived through over the last 4 years with regards to lockdown philosophy. Lockdown philosophy is not good for public health. It's not good for anxiety and for depression, for isolation, for school children not attending school. The numbers of pupils now not attending school 80% of the time has doubled, more than doubled. Pupils not attending school for 50% of the time has doubled, more than doubled. So this is not good provision for public health. It's ruinous to health. So those people in the Health Committee who will scrutinise this bill, if it gets to committee stage, are the people that we want to convince to produce a report that says that this bill is not a good idea. So I've been bewildered this weekend as to why the focus has moved from the Department of Health and the Minister of Health to a wider body of MLAs, including, well, all MLAs, all 90. Why were they not shouting from the rooftops? Some of us were. Some of us were shouting from the rooftops and alerting people to these dangers in this bill. But MLAs are very busy. Some of them have different responsibilities. Some were on the infrastructure committee, some were on the finance committee, and so they won't be across all of the detail. And no MLA has been asked to vote on a public health bill yet, and no MLA will be voting on a public health bill until the Minister of Health brings forward his bill. Now, Mike Nesbitt is the Minister for Health, and in many ways, he's inherited this legacy. But I do believe that this has been born out of the previous health minister's legacy, and that is the lockdown philosophy and all of the measures and all of the draconian measures and powers that he had received at that time. And so Mike Nesbitt's having to deal with someone else's legacy, someone else's baby, and you can see how. Well, I know for a fact because I received an email. Mike Nesbitt pushing out emails at 8 o'clock in the evening. So he's certainly, he's been stung, I think, by the criticism. Rightly so. It's his consultation. It's his responsibility. But I do think that Mike Nesbitt is a different person from Robin Swan. And I do think there may be hope here in turning Mike Nesbitt around. And so the pressure should be applied on the Department of Health, on the Minister of Health, and of course, the Minister's party, which is the UUP. They're the only party that voted for the extension in February. That failed. And so I do believe they have been stung with regards to that and with the criticism and the concern that's been shown out there in the wider public on this bill. It's been mighty. The interaction and the contact that I have received over the last number of weeks has been immense. I've been contacted by people since July. I've worked with Darren on some of the detail around this. Darren has kindly given up his time to meet with me, and we've discussed this further. So there is hope that we can turn this around. And I suppose my message is to the people, do not lose hope. There's a long way to go here. It doesn't end when the consultation ends. And in many ways, that's just the beginning. So there's a fight to be had. There's a war to be fought. But we can overcome this and we can win this. And the one other thing that gives me hope is that some people who would have been criticizing my stance on lockdown philosophy over the COVID years has come back to me to say, look, you were right all along. You told us so. We were critical of you. We criticized you. We thought it was political. We thought it was personal. Now we know it's not. Now we know you were trying to protect us with regards to the overreach of government. We never thought we'd ever see a bill like this or a consultation for a bill like this. And we are actually quite scared about some of the provisions in this. So if we can convince people who were completely hooked on the deployment of fear 4 years ago, and rightly so, what I've learned over the last number of years is when government deploys fear, it's probably the biggest weapon that a government has. And that really has an impact on people. And the amount of people who were frightened into compliance around some of the greatest excesses of draconian power that we have ever witnessed in our lifetime really shocked me. I didn't think that people would fall for it. They did. But I understand why they did, because they were scared. They were frightened. So there's hope out there. There's hope here. And we all need to work together and to send one message to the Department of Health and to the Minister of Health that this just cannot stand. You are breaching all sorts of conventions. You're taking away our rights, our liberties, our freedoms. And our ancestors fought for these freedoms. And there's no other way that we should be able to give them up or want to give them up through a public health bill. It's a misnomer to call this a public health bill. because it's ruinous to health. But there is nothing wrong with a minister bringing forward a piece of legislation that will assist public health. But this ain't it. The content that we've seen in this consultation is not it, and that'll do the reverse of what a public health bill should do. I'll end it there, Nathan. I'm passionate about this stuff. You know I am, and I tend to go on a bit, but I hope that's enough to inform people.
Yes, thank you very much, Paul. That was very, very enlightening, and I think it sets the picture about how this came to be, and some of the issues in terms of what the next steps in the process are. And I think what you say rightly is that nobody's against public health. Nobody's against a bill that even says public health bill. It's the content of the bill is the most important thing, and there are some very concerning elements of this bill. Even the health minister himself recognized that the other day. So I think what you've said there about Mike Nesbitt as well is very important. It's also a reminder that we're not here. That a lot of politicians will not have got say this until later on. Understandably, it was summer. There was a lot of stuff being put out by a lot of departments, and this document's 79 pages long. So it's a lot to disseminate. So that brings us nicely on to what is the content of some of the aspects of this bill, and it's great to have, and we're very fortunate to have Darren from the Advocacy Rights Network, and Darren and a lot of the ones in ARN have been fighting the long fight in terms of trying to ensure that people's rights are protected. In this instance and in many others in terms of public health. So, Darren, one of the most alarming aspects of this bill is its vague language around terms like infection, urgent health situations, what is a hazard, and it seems to leave a lot of room for interpretation. And from a legal standpoint, are there any issues or in terms of how this is defined that should concern us? Are there any powers that may be perceived to be open to abuse, and what are the potential risks in terms of overreach and violation of human rights? We're eager to hear your views on some of the challenges that this bill presents, and also maybe how it came to be and how it got to this stage. So what that means for civil liberties here in Northern Ireland. So Darren, thank you very much, and you can speak.
Okay, thanks, Nathan, and thanks, everyone. I'll try and keep it as simple as possible. As most will be aware, I'm not a lawyer, so we do have experts who speak on the law. But what I would say, first of all, is the concern that we have is that it changes everything from it being at the minute, it's currently health promotion. And what we're seeing now is now health protection. So it's changing how we are governed, Nathan. And that's a concern that advocacy rights have. You've probably heard us use the term governed, ruled over, governed with. So at the minute, democracy means that we should be, we're not governed, we're governed with rather than being ruled over. So this is totally flipping it on its head here. So what I would like to say, first of all, just on the actual consultation itself, I mean, there is obviously the consultation principles. It is very difficult to read. It is extremely long piece of legislation to get your head around, and any expert who would look at that would take them at least 3 hours to figure it out and to answer. The amount of questions in it is also 47 questions or so. So, I mean, most normal consultations should have about 30 questions, so it should be simplified. So that's the first problem that we have. And what they are using is what's called the Delphi technique. So by answering the questions within it, it's almost there like getting your consent by you taking part in the consultation. So what I would say from the advocacy rights perspective, first of all, is, as much as we are right to look at what's in the consultation, a lot of focus is on page 47. I would like to strip it back a little bit and just get people to think, how do we get here in the first place? I mean, something that is so powerful and changes how we are governed and changes the whole legislation law in Northern Ireland, this consultation should never even get off to the start. It should have been killed in its tracks, in my view. So that would be the very first question I would raise: is how are the people of Northern Ireland not involved with even this consultation in regards to it being put together? Because it's absolutely frightening what is in this. And as much as to say everyone's looking at page 47 and the vaccination, I do believe they will try and turn this into an anti-vax agenda here, and that's where they're going to try and focus in on. So we need to be very careful on bringing in the vaccination, which, as most of you know, that I do have an interest in with Fibs and I. But I think that's what they're going to try and do. They're going to try and use the anti-vax term here along with this. So we need to be careful and maybe use the likes of forced medical treatments. But the issue that we would have is the part where you were talking about hazards. So we need to know, where does this end? Hazards cannot mean climate change, cannot mean cybersecurity. It's absolutely where does this end? Because the consultation paper doesn't tell us where it ends. There is no set goals. There is no end dates with this whatsoever. So that would be a big concern that Advocacy Rights would have. Now, what we have done, if you go onto our website, which is www.advocacyrightsnetwork.co.uk, also on our Facebook page, Advocacy Rights have broken this down into 4 easy points to consider. And they're all little bite-sized chunks of information which can be downloaded on our website as well. From breaking down the bill itself, then moving on to, how we respond. Now, on the responses, some people are saying that your best may be putting in do not consent. What we would suggest is, look, you don't have to answer every single question on consultation. You can pick 4 or 5 out of the points that you feel that is of interest to you. Will that be 1, the vaccination, or 2, whatever you want to pick, but pick 4 or 5 and put in your own answers. You don't have to fill in every single question. But I still need to strip it back to the point is, we did not give our consent to this consultation to begin with. That is the overarching problem. So what I would suggest to people is, I'll let Melissa go into some of the finer detail later on. But what we would urge people to do is, look, we have time here. We've got to the 14th of October. So don't be cutting and pasting and panicking and putting stuff onto consultation papers. What we would suggest is, take your time, go on the Advocacy Rights website or the Facebook page, and look at the 4 points that have been broken down for people to understand and digest. We need people now to start thinking. We need people to understand what this is actually saying. So that's a very important point. So go through each of those 4 points, understand them. And then what we would also say is, this presents to us a unique opportunity, because we now need to ask the Department of Health, how do we get here? We now need to change things going forward. So we need to look at this in a new lens. So rather than the health department putting out this consultation and trying to change how we're governed, we should now be questioning and going, well, hold on a little second. That because this changes everything, we now need a new way of doing things. We need a new system, a new way where we're all included, that you can no longer just dictate to us and put this together and hopefully slip it in through the back door, which will obviously affect our lives and the lives of our children and grandchildren. So there's a lot to be looked at within this consultation paper.
Thank you, Darren. No, that's very helpful. I think what you'd said there is so right. It's when you think about terms, they're like from health protection to health promotion. From health promotion to health protection. That's a huge shift, and that's from the very preamble in the very beginning. And ultimately, I think everybody here is for health promotion. But when health protection comes in, that gives a wholly different definition, because it means that this one aspect of health that is being the sole focus means then that issues like mental health, means like schooling, means issues like that are all put to the side. And as you rightly say, Darren, one of the crucial things as well is the definition of hazard. Could it be an obesity crisis?
Yeah.
And does that then give certain people the right, government the right to take sweeping powers. And remember, when something is in legislation, you might have good politicians for 5-10 years, but we don't know what the politicians will be like in 10 years. So you do not want to put things in legislation that that you know, because you do not know who is going to come thereafter. So, and it sets the whole thing in culture. So we're now going to move to Melissa. Thanks for coming, Melissa. I know you were another meeting there, so thanks for taking time out of your busy schedule. So, Melissa, you know, maybe it's simplifying some of the language. It's a very long document, as we've said. There's 79 pages, and the proposed public health bill seems to grant unprecedented powers to authorities, allowing them to make sweeping decisions about very little oversight. And I must say as well, this is not a bill, this is a consultation on a bill, okay, potential bill. But if goes through without any amendment, there's certainly things, the language around what constitutes a public health threat is extremely vague. As we had said, urgent health situations, they leave a lot of room for interpretation. So from your expertise, can you walk us through some of the specific risks that this poses, and what are the potential consequences for individual rights, freedoms, if these powers are misused? And we look forward to hearing your insights as part of this webinar, so you can tell us our thoughts and tell all of the viewers who are listening in sort of some of the issues that are coming from that. So thank you, Melissa. We're going to hand over to you. Melissa, you're just on mute. You just...
They're not being clear on what rights you're going to have to give up for this so-called protectionism. So under the European Commission of Human Rights, it would be a breach of Article 2, right to life. 3, it's inhumane and degrading to forced medical treatment. 5, liberty. 6, fair trial and the right to hearsay and test the evidence. 8, right to privacy and family life. And 10, freedom of assembly. So it's flying in the face of all ECHR case law, for starters. The forced protectionism, I think that's where we have to keep the explain it more to people. So the question I've been asking people, it's breaking it down so that people can understand. So the predominant question I've been asking people is, do you think healthcare should be criminalized if we don't accept it? There's nobody can say that that would, if that was put in the consultation, that wouldn't be accepted. So what they're trying to do here, the other way I've been explaining it to people with the presumed consent is, if I was to say to my children, we're moving to Australia, so do you agree or disagree with taking our belongings? Now I've opened up a discussion about, should we take beds, instead of what the real issue is no, I don't want to move to Australia. So I have moved them away from that into presuming consent on that. And that's the best way I've come across. When I'm telling that to people, the presumed consent argument, that's where the light bulb is going off with people. Now, on a deeper level, on page, point 68 would be worrying to me. In an instance where the novel nature of a health threat, and we know that all hazards can possibly can go on natural disasters to cyber threats, into maybe power outages, banking collapse, and there's no clear agency with the power to act. The PHA will be able to authorise and resource the proposed functions, either to be undertaken by another body who they don't state, or to carry out the functions. This is given then the PHA ultimate authority. And then if we move on to, I think it's point 190, they will also have veto. Point 190, the Department of Health is the default regulation making authority. And secondly, any regulations made by another minister need to be agreed with the Department of Health prior to making. That's following on from point 188. So the Health Minister has power of veto over all other ministers. So say like in a 28-day time frame. The consultation principles are not being met here. I think that that's what we need to target, and that's what we need to target specifically within MLAs. I'm kind of gearing up now towards steering people to go to their MLA and say, I don't understand it, I need your help filling it in. Because then that's now when it gets to them, because it shouldn't even be getting to them. It's not clear and concise. It's a lengthy document. The 2015 document was 22 pages and 21 questions. This is 79, and 47 questions. It's restricting. You're not able to give an informed response. That would be point C in consultation principles. You can't give an informed response. You have to give a restricted response, and it's not giving you all the details of what the diseases that they want to include, what is the method of diagnosis, that there's what is may in terms of court orders. It's are or may be infected. Well, what's may be infected? Is may be infected contact tracing? Consultation principle C as well states that they should do a cost benefit analysis. Well, let's just do a thought experiment where one child goes into school and sneezes and tests positive. All school, that classroom has to be shut down, but maybe they were out at lunch and out in the playground, so that school has to be shut down. It states within it that the principal has to give all the details, the names and addresses of all the school children to the PHA, so they can go out into every home and shut down that home. So theoretically, with that thought process, Northern Ireland could be shut down within 24 hours if one child sneezes and tests positive, based on what they're suggesting within this. It's incredibly vague. It should never have, the fact that they have even produced this to consult the public with is an insult to the public. They're telling us that we didn't act correctly during the last pandemic and that they don't trust us. So the people that we elected to trust to represent us are telling us that we are not responsible, that we need protection, that they don't trust us to do the right thing, and they need to criminalise us for healthcare. It's the more I read it, the more things that I'm seeing that's showing up. There's also issues with, I think that possibly the reason that Northern Ireland was chosen, they're choosing the path of most resistance in terms of vaccine. We have less than throughout the UK and Ireland in terms of vaccine uptake. But also, if you want to, the pandemic treaty has failed. On a macro level, that has failed. So it seems that they're trying to start getting it out through a micro level. So they have it in, it was in Richie Allen, and somebody says that they already have it in the Netherlands. We know that they have it in New Zealand, they have it in Australia. So if you were to bring it into Northern Ireland, then in terms of the Good Friday Agreement, in terms of freedom of movement across the border, how would that affect us? So then that angles for the south of Ireland to bring it in. But then how does that affect travel to the UK? So it's a way to get it in across England, Ireland, Scotland, Wales by targeting Northern Ireland. Because why else would it be us? And they're bringing it in by saying that they need to keep us up with the other legislation in terms of all hazards, which they don't define. I think it's completely unacceptable to extend it. I think the answer is to completely scrap it. And Darren has sent me something that they are now talking about. This needs to be completely rewritten. And I agree with Darren. This is our opportunity to say that we don't accept government protection in any capacity. We don't want to move into the surveillance state. Quite a few mentions of surveillance within this document. We don't want to move into the surveillance state. So even if vaccine is removed out of it, and they're trying to say that it's conspiracy theory, that it's forced vaccine, literally says in the document, court-ordered health measures and compulsory medical treatment. That's, it's explicit. This is our opportunity to move back towards them and say, we see what you're doing here, and we see where you think the parameters of your authority are. We need to redefine the parameters of that, and you need to consult with the public about the health service that we want, and that needs to start with access to GPs, which that we're not okay with that. So that's some of what I've seen. I've put out the video with most of what I've seen in it, but terrified would have reading two-tier police system. Point 56, a definition of authorised officer will be these who can go into your home and will be included in the bill to mean any person authorised by the PHA. So that's a two-tier policing system, that they can override the policing system. Will they be trained in chain of custody? What let's say is that they will be given a range of special powers. Then point 124 is also changing the rules of the magistrates court, that you don't have the right to hearsay and test the evidence. This is, in the middle of reading it, what I was saying is this should be a criminal justice bill. It doesn't seem to be anything got to do with health. It's an attempt to, under the guise of public health, they're attempting to change the magistrates court, the policing system, and our relationship with the government, and they're presuming our consent with that. And the people of Northern Ireland need to be aware of that and say, we do not consent to a protectionism way of ruling over us.
Yeah, no, thank you very much. And there's a lot to digest there, because you're talking about 79 pages, and there's a lot of stuff. I think fundamentally, when people are sort of saying about, conspiracy theory, just read the document. That's all I would encourage people to do. Read the document, especially page 79, and also the first page too, because that sort of sets the preamble about what is being set out. Look, I think what you said, Melissa, is very interesting, particularly about some of the definitions of and how this undermines core rights from even the EHCHR, but more fundamentally, even the fact that it talks about forced vaccination, and we know that the department have put out a clarification the other day to say, well, no, we're not quite in favour of that. Although there's certain it's couched in certain language which could imply that they're not totally ruling out vaccine passports and such like that. We don't know, but it doesn't. The language again is just so vague. When we're coming to legislation, language needs to be defined, especially language that has an impact on rights, and core human rights and personal freedoms. So I think a lot of what you say there, and look, we do have concerns over data, like this is this sensitive health data, and I think there's discussions there about things, and what thing is hasn't been clarified. Thing, it's and by the way, folks, that's in the consultation. If you read it, the word thing could mean anything about human material. So could that mean human DNA? Could that mean fingerprinting? We just don't know. And again, we don't want to speculate, but we're just saying, and we're just pointing out the level of broad, vague definitions that could be used against the citizenry, and that is what we're concerned about. And I think ultimately, when we're looking, there were things that were done in the pandemic. The pandemic, that was a gross violation of human rights and disproportionate. And now even the pandemic inquiry is recognizing that not all of the aspects of human health were taken into consideration. And that's inevitable. When you've got panic, when you've got mass panic pumped up by fear, which is pumped up by the media and government, and irresponsible language from ministers, and even things that, let's be honest, ministers knew were not right. Yet those same ministers were happy in a couple of days to breach the legislation, breach some of the guidance and the rules that they themselves put in place. And I think that's something there that we need to take in consideration in a lot of this stuff. And yes, Paul.
If I could come in there, you mentioned the issue about the definition of a thing. They clearly list out that a dead body is a thing.
Mm-hmm.
And I take exception to that straight away, because we looked at what they did, what the Department of Health did over COVID, where they didn't allow you to go to a funeral, they didn't allow you to go to a wake, they didn't allow you to stand at a graveside in the open air to attend a friend's or even a family member's funeral and interment. They bagged up your loved ones' possessions and burnt them. So all of that is what we have lived through. And what I would say to people when they are looking at this consultation, when they are filling this in, and when they are talking to their MLAs, to read this document and speak to your MLA and have your daughter, your grandson, your elderly parents in mind when you read this document, because that's who we're talking about. We're talking about human beings, and they've just classified a dead body as a thing. So when we manage life, we also manage death. And this is a step too far, and it's overreach in the highest proportions.
It's certainly a wake-up call, I believe, to the people of Northern Ireland as to what exactly has just taken place. And I honestly do think that because of what has happened and the overreach within this document, I mean, if you look at even things like harm, I mean, where does harm end? They don't tell you where harm ends. They don't tell you where hazards end, and that's the thing. So you're actually been asked, you know, would you live in a world where anything and everything can be a harm, and that you need to be protected by your government? I mean, that is absolutely frightening. The scope of this bill is not just on the consent of vaccination. It's so much bigger than that. And if we do not get this stopped at this stage, it's game over. We have lost every single little bit of freedom and choice that we have, and we have handed everything over to our government. So this is why we need to tell these people, we don't even accept an extension to the consultation. On what authority did you have to even, the Department of Health even have to put this consultation paper together? Where was their authority to do so? And why? And this is why I don't want to get bogged down on the, well, I do, but I don't feel that we should be accepting a consultation extension. I don't feel that we should be happy to accept some crumbs in this, because we shouldn't. I mean, it's just an overarching no. We just do not agree to this paper even coming together at this stage. I mean, it is so frightening what is in this paper. I mean, the health department can't have it both ways. So basically, you know, when it comes to health protection, so previously to that, you know, if they would have kept us safe, you know, you would have relied on their standards to say, you know, things like, you know, if there was a disease, or if there was, you know, around vaping or around stalking and things like that there, yes, they would have brought in things to protect us. But now, instead of that, you're being urged to set aside naming harms in favour of agreeing everything can be a harm. It's absolutely mind-boggling. It just gives them so much scope to do what they want when they want. You know, rather than make laws and that outlaw harmful acts or deal with specific instances, grant permanent enormous powers, allowing absolutely freedom for restrictions and interventions in your work and family life, not to mention your own body, all to keep you safe. I mean, it's frightening. The health department can't have it both ways. If they're saying this now, this new great idea of all hazards is the way to go, won't that mean that you are, as a parent, no longer able to advocate for your children and have the final say on what goes on with your children? Are they going to come and take your children and put them, isolate them for 28 days? I mean, we need to look back at what has happened over the whole COVID period when children were locked down. I mean, the figures are there on the mental health problems that children had. You know, the lockdowns, as much damage as they cause, and they're going to go back to this again. I mean, what mindset are these people in? Are these people in? You know, I mean, that concerns me as a parent, that I wouldn't have any say over my children and on their health protection measures. Is that not riding a coach and horses through the legal protections of informed consent? That's the problem. So that's where I think that we need to look at it's the powers that it gives the government, and where it is never ending is the problem. And it's important to keep your power in this and respond on what you see. If you disagree, why you object, and obviously say it, and do not give your consent to this whatsoever. I mean, even me as you know, within VIBS. I mean, I have a meeting tomorrow with the Health Protection Legislation branch, you know, with the concerns of VIBS and I representing and giving a voice to so many people who have been vaccine injured and bereaved. You know, it's frightening. These people are absolutely frightened to their core that they could be forced into taking a vaccine that's already caused them harm or caused their family bereavement. I mean, it's not acceptable whatsoever.
Can I just speak about the dead bodies issues that Paul was bringing up?
Yeah, no, there's no problem, because I think this is a core part to this the proposed legislation when we look at the whole issue. So yeah, go ahead. Yeah.
Yeah, but my mum actually died during the first lockdown, so it was the 12 people at the funeral and everybody else behind a wall. But which is not the dignified service that she deserved in the life that she lived. So a lot of people had grievances about that. There is an issue that then there won't be autopsies as well within this, and that obviously is open to abuse. But they actually add another layer on. They're threatening to fine the bereaved if they don't meet the requirements, where if the your loved one who's passed was deemed to be infected, you have to put notices in your house. That's point 161 of the person is in charge of control of the premises in which a dead body is located, a notice prohibiting any person from entering the room in which the dead body is located or having any contact with the dead body. That's horrific. When you have somebody, when you have a loved one bereaved, to start having to put up notices as if it's bails for the unclean, that's disgusting. To put that in, and they are alluding to contact tracing. So that can be not if that person is necessarily infected with anything, because if you go to point 6, it's the signs and symptoms, the evidence that they need, and the person's recent contact with or proximity to a source or sources of infection or contamination. So there's your contact tracing. Point 138, I know that I helped people get out of quarantine hotel during the lockdown. They weren't of the understanding that they were volunteering to be there, that they'd signed a volunteer to be there, and they're closing that loophole where a magistrate's court imposes a requirement that a person be detained or kept in isolation or quarantine, and isolation is different from quarantine. So how does that affect, say, a mother who's put into isolation? How does that affect her family life? That the person leaves that contrary to the requirement. A constable may take a person into custody and return a person to that place. So now it's almost prison detainment. And in terms of that place, it's not necessarily a hospital, it's a hospital or other suitable establishments, again, which they haven't defined. Now, what they've omitted in this document, but they haven't talked about at all, and this is another way of maybe explaining it to people, would you be okay being kept off work for 28 days without pay? They haven't said anything about what happens if business is shut down, what happens if, does your employer have to pay you? Does the government have to pay you? Is anybody going to pay you? There will 100% be damages to people's health and possible probable deaths from any forced medication. They haven't talked about will there be compensation for the people in a failing NHS who's going to pay ongoing medical treatment from issues. All of that is omitted. So there's no protection for the vulnerable that will pay for the consequences of this, as Darren has experienced through FIBS. They're not mentioned. There's no protection for them. So who will be protected in this bill of protectionism from government? We know previously that companies received indemnity.
Yeah, no, thank you. And no, like that is a very good point. When you consider that lockdown, there was furlough, and here's the other thing as well. Even if it does specify, will the UK Exchequer have the money to do a furlough again? We're all now living this cost of living crisis, and a lot of that's down to the fact that money has been printed, like Billio, to fund our debt from COVID, and I don't think we can do the likes of that again financially without having some sort of inflation, which would also devastate the country again. So no, look, there's a lot of things there said, and I think my just want to clarify as well. There was a statement there about data harvesting and stuff. I'm telling you that we have to be careful about what we're doing with our data, and government needs to be very careful what it does with our data, because this data can be once it's there on the internet, all it takes is one cyber attack, all it takes is one hack, and all of the data is leaked to who knows what and sold on to who knows where. And now I know it was said about Robin, it was said about Rishi Sunak. I'm sure they're when they didn't know what was happening, and some of those things that maybe have been sold on, it hasn't been through their will. But these things we have to be careful of. We have to be very, very careful about what we're doing with people's data as well. But look, I think what we agree here is that as we move towards closing this webinar, it's clear that the proposed public health bill raises significant concerns, and we've heard from Paul about the political ramifications, the process, and how this could reshape the balance between public health and personal freedom. Darren has simplified a lot of the issues and explained, tied the whole vague definitions to potential overreach. And Melissa has spelled out some of the most strange words and most concerning aspects of the overreach, and we need to be very much aware of that. And I believe that there may well be public meetings about this over the next couple of weeks. And there's, as we know, there is an extension to consultation. Take Darren's point that, look, it's totally abnormal the way in which this has been extended. And we have to be careful. But I'm also encouraging people to make their voice known to their MLAs, make their voice known in this consultation, because it needs to go. Look, we can't rely on the Human Rights Commission, we can't rely on the Equality Commission to take a stand. It's only the people taking a stand and speaking to their elected representatives and making it clear that we're not going to have a situation again where power is just seized by government without people saying, hold on a second, we are going to stand up here. So one of the things, so it's important that people do get involved when they see this and be informed. Read the document, listen, speak to your MLA, ask for clarity. What does this mean? What does that mean? And also I believe as well that there's a VIBS event, Darren and Paul. And so maybe, Paul, do you want to tell us when that is and where it is and what's it about?
Okay, I'll go first, Darren. So FIBS and I have done a tremendous piece of work over the last number of years representing the vaccine injured and bereaved community in Northern Ireland. These are people, and for the most part, who have been coerced to take a medication, which was a crossing of the Rubicon during the lockdown period. But we have now been successful in getting 3 signatures. Me being the main sponsor, my party colleague Michelle McLeveen, who was always up to support, and then we had to get, because of the rules of Stormont, we had to get somebody from the national side of the House, an MLA, to sign. And unfortunately, the 2 parties were their MLAs were prohibited from signing this for this event to take place. And I simply believe that's because the parties are embarrassed that they actually supported the vaccine certification scheme, which coerced people to take a medication that gave them adverse reaction.
Are you frozen, Paul?
I think Paul's frozen. Darren, do you want to just continue? Really?
Yeah. So yes, on the 14th of October, it's as far as I'm concerned, and I know Paul is the same thinking. This is the first that this has been achieved anywhere, not only in the UK but anywhere in Europe, to get this far and to get this recognition. So we hope to have the health minister there at the very end to make a speech, and hopefully that will then you'll have to listen to the voices of those who have been injured and bereaved. And not only that, we did get a meeting with the first and deputy first minister at Stormont Castle, and we did get recognition from the first and deputy first minister that they recognised the people around that table were vaccine injured and were bereaved, and they did agree that the vaccines were indeed causing harm.
Yeah.
So it's a huge achievement for VIBS-NI to get it this far.
Yeah, and we have to remember that all medical treatment comes with risk, but especially that medical treatment that has not gone through the proper testing. And I think that has to be recognised. And those people have lost out. They've lost a health, and some have lost a family, and that must be recognised. So what's the date again?
It's the 14th of October, and the event is about, it is for the vaccine injured and bereaved, because for so long they've been gaslit by their government, they've been gaslit by their MLAs, they've been gaslit by the media, and they've been gaslit by their GPs that there was nothing wrong with them, that the vaccine was safe. So this is their day where they can stand and speak and tell practically the world, because it will be filmed, that they have been vaccine injured and bereaved. So it is a huge day for those guys. It's not about VIBS-NI. It is about giving them a voice to speak. So it's a huge achievement that they got up to this point.
Yeah, and it's a big reminder what can happen when you've got fear and you have coercion. And remember, the medical ethics from the very beginning has always been about not enforcing, that is, not putting pressure on patients to take treatment, but actually to work with and give informed consent. And that was something that some people did not get because, well, they were being coerced by the vaccine certification, and that was very, very sad. And I know some people out there who say they wish they'd never got it, but they felt under pressure to do so. I think that is across, and this is why it's so important to get this right. And I'd like to remind everybody that we, Liberty-NI, we stand firm in our belief that while public health is crucial, and there's nobody here that disagrees with public health, nobody disagrees with the public health bill, but it shouldn't come at the expense of personal liberty. We shouldn't transfer health promotion for health protection. We shouldn't public health shouldn't come at the expense of personal liberty, civil liberties, religious freedom, or fundamental rights. And this bill, as it stands, the consultation as it stands, threatens to erode the civil liberties that define a democratic society. And before I'd wrap up, I'd like to remind everyone that the public consultation in this bill has been extended to the 14th of October, and it's essential that each one of us takes time to submit our concerns and make our voice heard. This isn't just about preventing a bad law, it's about ensuring our society remains one where freedom, democracy, and respect for individual rights, personal liberty, are paramount. So I want to thank Paul, Darren, Melissa, and Wesley, and everyone who's joined us today. And together we can challenge this legislation and advocate for a fairer, freer Northern Ireland. So stay tuned for further updates and actions, and let's keep this important conversation going. Because this is just the beginning of a conversation. If this is a bill coming through, this is going to be big news for the next couple of months and years ahead. So we just want to wish everybody to have a great evening. Thank you very much.
Thanks, Nathan. Thanks, everyone.